In this swing drill, we'll start to explore the concept of kind of weight transfer. So within more anatomical definitions, a much more accurate, a much more precise, almost definition in many ways, is the idea more of kind of how we load and compress joints. So really when we look at kind of how we move pressure through our system, in essence, it really is how do we load or actually unload joints and really help move that pressure and almost increase that kind of sensory awareness as you move and rotate through swings. So in this tutorial, we'll really start to explore some reference points we can use through backswing. We look at those kind of main connecting joints. So in essence, we really have three main kind of points of connection anatomically when we look at really how we rotate and how we move pressure, how we load through backswing. One being then very much the trail ankle, how that connects into the trail hip, and then consequently then how that then connects into that trail shoulder, and equally so in downswing, how we kind of invert those kind of connection points in some ways as far as then how we kind of load to that lead ankle, how that then connects anatomically into then how we kind of compress, how we load once again around that lead hip, but then consequent in this case, how we still get that pressure, that connection through that trail shoulder and trail scapula. So in a very, very playful way, let's explore more the concept of really how we load joints, how we kind of unload, how we load those joints, those pressure points through. So rather than the kind of the approach of kind of how we move weight or weight transference, which can be much more ambiguous, kind of much more almost kind of challenging, and almost conceptualize and perceive in many ways, but certainly from a kind of almost a much more kind of sensory base, those mechanoreceptors in our skin, which really kind of detect kind of touch and movement, but from a much more sensory based understanding, how can we kind of load those joints, get that much more kind of sensory stimulus, which then very much connects back then to kind of how we move within our goals. So let's kind of use some reference points we can use, both to kind of very much kind of improve those loading, those connecting points through backswing, and then consequently then how we can then really start to improve those connecting loading points in downswing. So using the wall can be a very exploratory, very evocative way of really helping increase that sensory awareness, those kind of connecting points, those loading of joints, much more than weight transference, it's much more joint loading as we rotate through backswing. So as we discussed that, as we rotate through backswing, there's kind of really those connecting points of how we can load, how we can pressure the ankle, how that kind of then connects into that trail hip, and then consequently, more anatomically then, how that then connects into that trail shoulder. So very much that kind of, that ankle, that heel connection, very closely connects into then that stimulus, that kind of almost that awareness of then how we very much connect into and compress around that trail hip joints in some ways, kind of ankle activity very much connects into kind of glute activity in some ways. And then as we kind of start to spiral up through that chain, how that then very much kind of moves into that trail shoulder. So as you kind of rotate through backswing, being very aware of kind of pressuring, loading through that trail ankle. Once again, as we kind of push the ankle downwards in some ways, we're trying to push that femur, that long bone in that kind of trail leg as it would be in this case. We're trying to push that femur upwards, so it very much kind of moves up into, kind of in some ways really drives up into the hip joint, the acetabulum, into that pelvis. So once again, as we're kind of pushing the ankle downwards, as we're really compressing that foot downwards, very much almost the responsive, almost kind of subsequent then responses, the femur is being pushed upwards very much into that kind of acetabulum, that hip joint. So being very well of that kind of push, almost kind of conflict. We're trying to push the ankle downwards as we kind of push the femur upwards. So very much kind of stimulates in and around that kind of trail hip, that acetabulum, that femoral acetabulum connection into the ankle. So push the ankle downwards, push the femur upwards as we start to rotate through backswing. Alongside this then, very much just kind of placing that hand on the wall. It's very actively, very sensitive. What it isn't, it's kind of really pushing that rib cage left. It's can we keep that pressure to the ankle? Can we keep that femur pushing up? Can we drive that femur really up into the acetabulum? As we kind of rotate through backswing, pushing the hand onto the wall, as you push the ankle downwards, as we push that femur upwards to very much really increase that sensory point kind of through the ankle, through that kind of hip joint into that shoulder. So there's kind of three loading points, how we can load that scapula, how we load that shoulder, how we load the hip joint, how we load the ankle by pushing the ankle downwards, pushing that femur upwards, and then very much connecting into that trail shoulder as you rotate through backswing. And really just to expand on that then more so for kind of how we move in downswing. Again, very lightly, is as we keep that pressure on that trail hand, is as we glide the pelvis laterally as it rotates towards the target. Can we now start to pressure the lead ankle? Can we start to really drive? Can we start to push that femur upwards once again into that hip joint, that acetabulum, as we just start to push that pelvis and glide that pelvis to the target. So once again, as you push the ankle downwards, as you drive the femur upwards. It's still in that initial phase in transition, still keeping that very light pressure. In some ways, only kind of 5% pressure on that trail shoulder. So as the pelvis is glided, once that lead hip in many ways kind of then sits above that lead ankle. So that lovely kind of long kind of vertical vector we're trying to produce through, pushing the ankle downwards, pushing that femur up. So very much the kind of ankle pushes down, the femoral head pushes upwards as you start to rotate the downswing. Just using that right hand now, almost placing on top of that left thumb. Can we push the right hand into that thumb, that lovely kind of movement conflict? So we can push the right hand downwards, but very much let that left thumb collapse and moving down. So lovely conflict in some ways. Using that left hand as that kind of breaking point, using that right hand to really apply as much pressure, much joint loading as we can into that lead thumb, as we push the lead femur upwards, as we push that lead ankle downwards, to really start to again improve that awareness, that connection of kind of those kind of loading points. So once again, what we're looking to really encourage is not so much how we move weight through the golf swing. You know, the idea of weight transfer is very ambiguous, kind of very hard to kind of perceive and almost conceptualize in some ways. A much more accurate definition really is kind of how we load joints, how we load them, how we unload, and how we pressurize those joints and swing. So once again, as you rotate through backswing, it's pushing that trail ankle downwards, very much moving, driving that trail femur upwards. Those lovely kind of how we load the ankle, load the hip joint, load that trail shoulder by placing that hand on the wall, actively try and push the wall away, but without that kind of ribcage really changing position as we rotate back. So use the wall in some ways to really actively increase that rotation through the spine, push the foot downwards, push the hip upwards, load that shoulder. So 3 connecting points through backswing. How we load the ankle, how we load the hip, how we load that trail shoulder. So using that kind of trend to really kind of almost encourage more rotation, more expansive rotation through backswing without necessarily really changing position through those kind of main segments, mainly through that kind of pelvis, neck, head and ribcage. And then in downswing, as we glide the pelvis, using that trail hand just to actively kind of move that pelvis towards the target. Can we then load that trail ankle, pushing the ankle downwards? Can we load that trail hip, push the femur, really pour that femur up into that acetabulum, that joint stimulation? Once again, those mechanoreceptors on our skin, those sensory kind of sensors we have in some ways, which we can then very much kind of stimulate and very much create that awareness of as we push the femur downwards, as we push the hip upwards, and really create that kind of sensory feel in some ways through swing. But as we just start to glide the pelvis, so the hips on top of the ankle, then by placing that left hand, so the thumb in this case is would be for the players in that position, using that trail and very much actively try and push the hand downwards, connect the ankle, connect the hip, connect that trail, and to really kind of start to then really explore much more anatomically a much more precise, much more advantageous approach is much more the awareness of how we kind of load joints, how we unload, how we load joints, rather than how we move pressure, or certainly how we kind of transfer weight. So the idea of weight transference, that can, like I say, be slightly more of almost a challenge and one to perceive, to conceptualize, and almost accurately then kind of produce in swing. But the idea of joint loading from a sensory feedback understanding, from an anatomical observation, can be a much more precise and much more advantageous way of exploring how we move pressure then through our body.